Welcome to Critical Connections Live. I'm Judy Jacoby, a past president of the Society of Critical Care Medicine, and I have the honor to interview today our new president of SCCM, Dr. Jerry Zimmerman. Jerry, as you now are becoming the face of SCCM for the next year, it would be helpful if you could tell us a little bit about yourself and your career in critical care.
Thanks for the opportunity, first of all. I come from a background in Wisconsin. I grew up in a small town. All of my friends lived on a farm, and I think that was a good thing in terms of closeness of community and the way things were then. Anyway, I ended up at the University of Wisconsin in biochemistry and chemistry, organic chemistry, and actually stayed there for 16 years. And if I had somebody to pay for it, I'd go back tomorrow. But I did my undergraduate work there as well as graduate school and then medical school, and I also did my residency in pediatrics at the same place. After that, I was fortunate to do a fellowship in Washington, D.C. My first job was in New York at Upstate Medical Center in Syracuse. Went back to Wisconsin for a time, and then in 1998 moved to Seattle and have been working at Seattle Children's Hospital and Harborview Medical Center there for the past 20 years.
So you spoke in your wonderful presidential address about how you really want to focus on high-value care. And for me as a pharmacist, de-prescribing is an important part of what I can contribute to the team. But you use the theme less is more. Can you elaborate on that a little bit?
Sure. So I think all healthcare practitioners are keyed in on quality, and that's in the mission statement for the Society of Critical Care Medicine, to provide the highest quality of care to all of our critically ill and injured patients. But we don't think about the cost of this quality. We haven't been forced to think about it very much in the past. I think that's changing with the way that healthcare is being reimbursed, but the point of my whole talk was that you don't have to be a genius to think about ways that, as an individual at the bedside, you can reduce costs. So certainly, as you just pointed out, there's a great emphasis now on using less antibiotics, for example. We don't probably need to treat anybody for 2 weeks for normal types of infections. And in fact, we now have biomarkers that can help us make the decision to discontinue those antibiotics a lot sooner. And there's lots of examples of things like that critical care practitioners at the bedside can do to maintain really high quality care, but do it at a much lower cost, and that's value.
I love the emphasis on the Choosing Wisely campaign, and in particular, perhaps not even initiating as many interventions such as daily labs. And can you tell us a little bit more about your focus on that campaign?
Well, as you know, there's 5 elements to Choosing Wisely currently, and these are 5 practices that, by consensus, a group of critical care leaders pointed out provide no value and increased cost. So there's also controversy around these 5 items, but in general I think it has begun to increase people's awareness of the possibility of lowering cost with provision of critical care. I think there's interest in SCCM at looking at the Choosing Wisely elements. Do they need to be tweaked a little bit? Are there other things that we could add to that list? I think there are, and we are going to deliberately take a look at the possibility of doing both of those things.
I know it certainly is. Many of those things are great starting points for discussion at the bedside when the whole team is really trying to do the best care for a patient.
Exactly. I think those could all 5 elements of Choosing Wisely could be quality indicators. check boxes at the end of rounds. Have we thought about this?
Yeah. Very good. Now, obviously, in pediatrics, the whole family is implicated and involved and affected when there's a critically ill child. It's
Right.
true, obviously, in adult care as well. And so what's been your focus on the care of the family, and how would you like to continue to work on that?
I guess just an interesting historical perspective here. When I came to Seattle, the nurses dragged me kicking and screaming off to Lake Tahoe to attend Family Centered Care Institute Congress, and I've never looked back. This is the right thing to do, and I am, every time on service, impressed by the fact that when family members can make it on rounds, they always have a perspective that is meaningful and perhaps even related to safety issues, like, don't do that. My kids you've already tried that. Maybe not this admission, but last time it doesn't work.
True.
Do this instead. This is what we do at home and it always works. So it also is great for the family, in my impression, to see the whole team. Everybody on the same page at the same time, see the difficult, sometimes, decision-making that has to go on. I think families appreciate seeing that interaction and the process involved in care.
So SCCM certainly has some programs really focused on that, such as the ICU liberation and family-centered care.
Yes.
And what do you see for the future of those programs?
Well, one of the latest things that happened, and this is spearheaded completely by Ruth Kleinfeld, who's our immediate past president, as you know. She undertook this project called the PCOR ICU, Patient-Centered Outcomes Research in the ICU. And this is actually focusing on that fifth element of ICU liberation, and that is getting the family engaged and empowered in the care plan. And so this collaborative, which has been going on for approximately a year and a half, funded by PCORI, has generated all of the different ways, and there are lots of them, that families can really get more engaged in the care process. And I have to say that we had a report out session this morning, and it is amazing how many ways that families can get involved. I think eventually there will be a qualitative analysis of this collaborative, and this will identify the practices that people think have made the most difference in involving families and patients.
Well, that certainly will be wonderful information to have, and I think we can all do better when it comes to communication
Absolutely.
At the bedside and with families. So I've been a member of SCCM for a long time, and it's been quite a while since I was on council with you. You came in just as I was pretty much departing, and but we have overlapped a little bit and shared some wonderful experiences. What do you think has been some of the best experiences for you in SCCM or on our leadership team?
So as you know, the council meeting is where the action really is, and this, as you know, is a multidisciplinary group, and it's like 30 or 40 people now from every aspect of critical care medicine. And I'm not saying this to impress anybody, but I am consistently astounded by the thoughtfulness of the group, the real proactive activity in being transparent, letting people understand the process of why we're doing this, a real kind of focus on strategic planning and trying to think ahead to what is critical care medicine going to be like 10 years from now, and can we be ahead of the wave, or at least riding the wave on what's going to happen, what is going to be most important next on providing the best care that we can.
Well, that's been a wonderful set of comments. I'm really happy to talk with you, and congratulations on being the new president of the Society of Critical Care Medicine. Thank you, Dr. Jerry Zimmerman. I'm Judy Jacoby for Critical Connections Live.